Well, hello, and thank you. It is really, really good to be with you this afternoon or morning or wherever you are in the time of day. A very, very special welcome to the new representatives at Membership Assembly. I remember my first meeting as a state representative and feeling a bit intimidated, but eager to help shape nursing's agenda for the future. Nurses truly are heroes. As many of you know, in addition to living through the pandemic, I've been navigating my own health challenges this past year. I am incredibly grateful for the care I have received throughout this journey, for the support that I have received from so many of you, from President Grant, from our board, and I thank each of you for that support, your prayers, your outreach, your cards, your emails, and most importantly, to the expertise and professionalism throughout a trying year of our nursing workforce. I come to you today recommitted to leading ANA into the future, and I am living proof of our vision. A healthy world through the power of nursing. It is the foundation of the ANA Enterprise Strategic Plan, and it's a theme that I believe would have even resonated with our ANA founders 125 years ago. They would be thrilled to see how nurses are being heralded around the world today as the heroes and heroines of the pandemic. Certainly, we have a lot to be proud of as a profession. Registered nurses in this country now number 4.2 million, and we are the largest of the health professions. Nursing schools are seeing a surge in applications, but sadly, schools of nursing still don't have the capacity to accept all qualified applicants. And in fact, the number of qualified applicants being turned away is growing. Although the ability of nursing schools to accept qualified applicants is currently limited, the outlook for creating a more diverse workforce of nurses is very promising. Given such a tumultuous year, we braced ourselves for a loss in membership at the ANA headquarters. But instead, we saw growth. This reflects nursing community's acknowledgement and appreciation that ANA was there for them 150%. We witnessed a renewed awareness among our members of ANA's value and support in advocating for them during this dangerous, stressful time for healthcare workers. And despite the pandemic, our basic values and the goals ANA established in its 2020 to 2023 strategic plan have not changed or wavered. We remain committed to engaging nurses at all stages of their careers. We made meaningful progress on the issues of diversity, equity, and inclusion, and improving our work environments. We promoted excellence through improvements in technology, project management, and operations. And we are eagerly engaged with the Biden administration and the 117th Congress on strategies to reform healthcare and ensure better, safer work environments for healthcare workers. Working in a country under the siege of a global pandemic made us pause and rethink our priorities. What did we do well, and where were the gaps we couldn't fill? At our virtual Tri-Council COVID Summit in December, over 120 nursing and healthcare stakeholders from across multiple care settings and from all levels of nursing discussed the implications and impact of COVID through the lens of nursing practice, education, and regulation. Now seeing a light at the end of the coronavirus tunnel, we are turning our attention back to advancing the nursing profession. Through a series of recommendations coming out of the COVID Summit, the Tri-Council for Nursing is addressing issues that nursing professionals have struggled with for decades, including health equity, innovation, disaster planning, and importantly, the mental health and well-being of our workforce. The discussion around these overarching themes honed in on 22 priority topics that represent key areas for transformation. And in May, the National Academy of Medicine released its long-awaited report, The Future of Nursing 2020 to 2030, charting a path to achieve health equity. The thoughtful and bold recommendations in this report will be carefully considered as the ANA enterprise refines our strategic priorities to shape the future of nursing practice and healthcare. Our work to embody the objectives and to achieve the goals identified in this report are already underway. Projects such as Healthy Nurse, Healthy Nation, our Wellbeing Initiative, and the National Commission to Address Racism in Nursing, as well as our dedication to advocacy efforts, innovation ventures, and credentialing work, will help achieve many of the suggestions outlined by the National Academy's report. We are committed to collaborating with nursing organizations, healthcare systems, decision makers, and healthcare consumers to advance a culture of health for all patients and populations. Caring for others is in the nurse's DNA. But during the pandemic, we found ourselves at ground zero, having to innovate and collaborate our way through situations we had never encountered before. The crisis inspired nurses to bring their ingenuity to solve everyday problems affecting COVID-19 patients and the hospitals treating them. Innovative solutions are our future. We must strive to continually evaluate our practices and find new ways to advance the profession. ANA is dedicated to building a culture of innovation, and our work exists to support the innovative, curious, and pioneering nature of nurses. I'm especially proud of the See You Now podcast series that we produced in partnership with Johnson & Johnson. Now in its 5th season, the 10-episode series on the COVID-19 nurse response spotlighted stories of nurses treating COVID patients. And in addition, we collaborated with the American Organization for Nursing Leadership and J&J on a project that showcased nurse-led innovations in COVID-19 care. ANA introduced virtual innovation lounges this year to encourage more forward thinking. This is a space for nurses to network, exchange ideas, and receive guidance. We also sponsor Nurse Pitch, a virtual interactive event where nurses can compete for the chance to turn their ideas into realities. We saw the resourcefulness and creativity of nurses in submissions to our 2021 ANA Innovation Awards. Our applicants came through with amazing proposals for care delivery models, devices, technology, new programs, and process improvements. Our individual winner, Rebecca Cherney, developed Trach Trail, which was a first of its kind education kit for adult patients leaving the hospital with tracheostomies. And our nurse-led team winner was Lavender, an online psychiatry and therapy office founded and operated by nurses during the pandemic. Lavender provides patients with modern, accessible, and affordable mental health care and is solely delivered by board-certified psychiatric mental health nurse practitioners. Additionally, the foundation is inspiring bold change through its Reimagining Nursing initiative, which focuses on promoting an adept, diverse workforce, establishing digitally enabled nursing practice, and fostering nursing-led and person-centric care delivery. Kaiser Permanente is the funder for the first phase of this work and has committed over $14 million to support this 3-year initiative. The national program aims to create the knowledge, tools, environments, and systems where the nurses of the future can thrive. Look for information soon about grant opportunities to fund pilots through this Reimagining Nursing initiative. We must also imagine a profession without injustices or inequities, one that is inclusive to all individuals and that better reflects our nation's population. Our Minority Fellowship Program continues to be a shining example of our commitment to bring diversity, equity, and inclusion to nursing. For almost 50 years, with funding from the Substance Abuse and Mental Health Services Administration, this program makes fellowships available to racial and ethnic minority nursing students who are pursuing master's or doctoral level education in behavioral health programs. Supporting selected fellows in achieving these degrees will help to reduce disparities in access to mental health care for for communities of color. And as President Grant shared earlier, ANA is one of the leading organizations of the National Commission to Address Racism in Nursing. Extremely important work. Together, the Commission is examining the issue of racism within nursing and the impact it has on nurses, patients, communities, and healthcare systems nationwide. Our diversity and inclusion initiatives also include collaborations with nurses and healthcare organizations worldwide. Nursing practices in many countries depend on continuing education programs accredited by the American Nurses Credentialing Center to stay current. We also contributed to global efforts to contain COVID-19 through our membership in the International Council of Nurses. We are rethinking our roles as nurses, especially after COVID-19. The respect we gained in the public eye during the pandemic has empowered us. Now we must build on these accomplishments so the value of nursing is better understood and remembered well after the pandemic fades. Recommendations from our Tri-Council Summit and the Future of Nursing report will serve as guidance in setting the pace and direction for the coming years. As we strive to reimagine nursing in the pandemic-altered healthcare landscape, models of care are certain to change. Technical advances will not be enough to see us through a burgeoning aging population with significantly more complex healthcare needs. With our rising stature, nurses have more opportunities to influence the future of healthcare, and continued membership growth will be key to increasing our impact. The nation has learned it can no longer underestimate its investment in public health and the social determinants of health. Engaging nurses in leadership roles at state and federal levels will enable us to move the country forward on legislation that will make healthcare available to all Americans. This means rebuilding the country's public health infrastructure and creating a healthcare model where nurses can spend more time with patients. In the future, we will see more emphasis on the personal well-being of nurses, on their physical safety and their emotional resiliency. We witnessed the toll the pandemic took on nurses. A staff of burned out nurses is not the way to achieve optimal patient outcomes or retain valued professionals. We will continue to advocate for better working environments so nurses are not pushed beyond their limits. Representing all nurses, ANA must be the North Star for every nurse. I look to this assembly to mobilize our membership, to help fulfill our potential as nurses, to provide programs and tools for nurses to learn at every stage of our careers, and to stand up for justice in the healthcare system, to lead healthcare forward with innovation and skill. We remain committed to our vision statement, a healthy world through the power of nursing. Let it be so, and let us make it so. Thank you.